everybody. This is Dr. Matthew Standridge, Associate Clinical Instructor with Gerety Orthodontics Seminars, and I'm really excited to have a little group panel today. First off, to my left, we'll start with everybody's favorite, who you all know and love, Kay Gerety, our Clinical Director of Education. Right next to me is Dr. Michael Auld, a fellow clinical instructor of Gerety Orthodontics. And to my right is Mr. David Lopez with Myobrace. And that's what we're really here to talk about this morning. So before we get started, David, give us just a quick synopsis of what it is Myobrace is and what it does.
Myobrace is helping children with their airway and health through appliance wear and education and actual exercises to help strengthen the muscles and really look at the causes that are causing these patients to develop incorrectly in the first place.
Wonderful. For those of you that are familiar with the Gerety philosophy, we are very passionate about early interceptive, or also known as phase 1 treatment. That's why we're really excited to bring David here and educate our doctors on this alternative mode of treatment. Kay, when we first kind of brought this idea of Myobrace to you, you seemed very interested and eventually very excited about that. Can you tell us and our viewers why it is that we ended up wanting to bring Myobrace into our interceptive program?
Absolutely. One of the things that we have tried, and especially in the last 10 years, to be more aware of is oral habits, tongue thrusting, mouth breathing, lack of nasal breathing, in particular, thumb habits. And I think we've done a really good job of updating the program and updating the diagnostic portion of our program to pick up these oral habits. But the thing that we didn't have, the thing that we lacked, we had all of our exercises in the book and the things that we would like for them to do, but we didn't have a specific protocol to implement what we knew they should do or what we felt like would be an answer to it. Plus, we didn't quite have all the tools that we needed to get done what we needed to do. A lot of times the patient maybe would need expansion, but we don't want to do expansion until we find out what's causing the constriction. So it was sort of a catch-22 with us to find an answer. And the more I learned about Myobrace, it seemed to be just a perfect fit for our program. So we decided that we would try and incorporate that into our 4th session of our comprehensive program, which is all dealing with interceptive phase 1 mixed dentition. So David joined us this weekend to present the Myobrace.
Wonderful. Speaking of that, one thing that's always a concern for our doctors is the process of implementation. So, David, if you could help describe to our viewers what your company does to help support and facilitate this process.
So we offer courses generally about every 3 months. We also have in-house training, so we'll come out to your office, train you and your staff hands-on how to implement the system correctly. And then one of the best ways to get your training as early as possible is to schedule a webinar training session. So wherever you're located throughout the U.S., Canada, Latin America, around the world, we'll be able to get to your office and your staff members and deliver that information and help you guys along the way. And we're always about one call, one email, one text message away if you have any questions.
Wonderful. Yeah, that's one thing that I've been very impressed with your guys is I will fully admit I'm new to this process, but the one things that the resources that you guys have for both team training and doctor training, but also the education modules and support modules for the patients and their parents is one thing that I think you guys really excel at.
Yes, yeah. We have apps now for both delivering a proper consultation, so the parent and the patient both understand what Myobrace is and what they're getting themselves into with this treatment, what we're offering, and also for delivering information to the patient for their exercises and what's going to be asked of them throughout the whole system. We have an app for that, for the activities. So it's really the name of the game is education. This is all about being compliant. They're going to wear appliances during the daytime, do exercises during the daytime, wear appliances through the nighttime. So it's all about them understanding why they're doing these things and influencing them to do them every single day and continue doing them. for a lot of time through the treatment.
Right. So, Mike, you've started using Myobrace quite a bit in your office, and you've been doing that for a while. Can you tell our viewers what that process has been like, and how not only the changes for your practice, but also the results that you've been seeing in your patients?
First, just off what David said, very easy to implement. The process of communication and the education that they've done with what we need to do and how we need to do it was very easy. And like Kay said, this just really allowed us to have a protocol for the patients that we knew needed intervention, other than us giving them some exercises that we had in our tool belt. And for instance, the kid that is still in their primary dentition, we already see some of these issues that they educate us on: a gummy smile, crowded lower primary teeth, constricted palate, high palate, mouth breathing, lower lip curl, these things that we were seeing, and our hygienists are now very educated on. We have an easy way to educate the parents about that, if nothing else, get them thinking about it, get them potentially watching for these things, and at best already have a protocol in place that we can start helping them and guiding them through the process in a way that's actually fun for the kids, not invasive, not difficult, not very time constraining for the doctor. They really teach you how to get your staff, your auxiliaries excited about this, and they kind of own that process, in your day-to-day. So it's been, without going to any of the courses that I still want to do, very easy and very effective in my practice.
Awesome. And you have one of your daughters in Myobrace, right? Tell us a little bit about that.
Yeah, it's always nice when you can see it at home and see the whole process. But Gwenny, my little girl, she's 5 now. We started her when she was 4. Really soon when I was going through this journey, she had a very gummy smile, pretty severe crowding already in her lower primary dentition at 4. And so we started her about 10 months ago. She's done excellent. She was able to wear the appliance through the night within the first week, and I've seen tangible changes already. Her smile looks better, her lips look different. She goes through the exercises. We have different exercises that they do, but reminders. I was telling David just earlier this week, she had her little sticker on her iPad, and so when she went to play her iPad, she went to get her Myobrace. So in my experience with Gwyneth, it's been a huge success.
That's wonderful. I mean, and that's the testament that we're all looking for,
Right.
especially on our 4, 5-year-olds. And
Right.
and I hear so many of our students say, I've got a 3-year-old that's snoring. I've got a 4-year-old that, I know is a mouth breather. What can I do now? And we've been so, our suggestions send them to the ENT and get an evaluation.
Yep.
And
Wait until the 6s come in, and then we can
right,
do something.
exactly. And so now this has given us just a completely different avenue. And before we were just at the mercy of the tools that we have. So I think this is a huge addition to our method and our mechanics.
Wonderful, wonderful. Well, anybody else have any closing thoughts for our viewers?
No, just more or less that Myobrace here is targeting the cause of all this, and really the crooked teeth is a sign that there's a health problem, an airway issue, not just malocclusion. And let's get to them early. Really, these children are going to continue to suffer or get worse with these symptoms as we go along, so as early as possible. But it's all about compliance. So remember with your patients that they need to be compliant with this, and make sure you select those compliant patients.
And one thing I would like to add, because it's one thing that I really realized this weekend, is that as we have grown in our courses and have added and changed, one of the things that we've said for years is, we're changing smiles. We are changing smiles. Well, I realized this weekend that we have the availability to change lives, to literally
Right.
change lives, because this is a health issue. This is a sleeping issue. This is a discipline problem. This is something that we can really make a difference in.
And more than changing smiles, changing faces, prettier faces, helps the craniofacial development. more symmetry to the face. So offer that to your patients out there. If they follow the protocol, if they do what's asked of them, they're going to see a lot of changes, whether it be dentally, health, craniofacial. It's all out there. It's available to assess and get at that point.
Wonderful. So, David, for people who want to learn more about the Myobrace system, what is the best way for them to contact you or place a resource that they can start learning this process?
No problem, no problem. So there's 4 ways to do it. Either if you're a patient, you can go on to myobrace.com. If you're a practitioner, we have myoresearch.com, and that's myoresearch.com. And then if you want to contact our office, that's phone number 1-866-550-4696. And then you can contact me directly at david.lopez@myoresearch.com. That's myoresearch.com.
Great. Kay, do you have any final thoughts?
I don't, other than I sincerely appreciate David coming and sharing his knowledge with us. I don't know of a single person here that was not absolutely felt the benefit from it. And we all learned. We all learned an immense amount about what we thought we knew. And now we see ways, instead of diagnosing, now we see ways to treat.
Great.
So I think it was just a huge asset to have you as part of our program.
Thank you very much for inviting me. I'm looking forward to coming back many times and spreading the word. We've been around since 1989, about 12 years here in the U.S., global company from Australia. So you can see all that information on our website, but we're going to be around for a long time after this. So everybody come and ask some questions.
Excellent.
Great. Well, thank you everybody for meeting up with me and shooting this little video. It's really exciting, the changes and the progression that we're making to the program while still encompassing those core principles that Big Bob practiced and lived by. So thank you for tuning in. I hope you found this valuable, and look forward to more videos like this coming in the future. So until we see you again, take care.